people are shy about discussing issues concerning sexual health, especially sexual dysfunction. But on Real Health, we like to invite expert guests in to help shed light on such topics, as it gives us solutions that can assist in dealing with these situations. So I'm joined today by Dr. Mark Opperman to discuss the topic of sexual dysfunction, particularly in men. Mark, sexual dysfunction, I think when men are talking about this or thinking about this, often it goes straight to erectile issues, erectile dysfunction. What are we talking about in terms of erectile dysfunction and maybe relative to sexual dysfunction?
So I think let's take a look at the definition of erectile dysfunction, and that's the inability to get or maintain an erection sufficient for optimal intercourse.
Okay.
And that can include not being firm enough or not being able to maintain that erection to complete intercourse.
Okay.
So that's erectile dysfunction. I don't like talking about erectile dysfunction on its own, and I prefer the term sexual dysfunction because there are so many other things that play a role. You might have the ability to keep an erection and have a good erection, but if there's a change in sexual thoughts and fantasies, and we refer to that as your libido,
Yes.
or your sex drive, the frequency with which you want to initiate or engage in sexual activities, that is a cause of sexual dysfunction. You're just not performing as well as you want to.
Yes, yes. So sexual dysfunction, I mean, so as you mentioned, erectile dysfunction, libido, but there are other major issues around the psychological side of sex in general that are linked to sexual dysfunction. And we've touched on this before. It seems there's almost this vicious cycle of effect, cause and effect, cause and effect.
Absolutely.
So take us through that specifically from a psychological point of view, which leads to sexual dysfunction, how that starts and where it ends up often.
So, Michael, I think the easiest way is to think of it as performance anxiety. If you have a failed erection during a sexual encounter, there's many things that can cause that. You were tired, you were a little bit inebriated, it was just not a good mix, or chemistry wasn't there. But if that continues happening, it creates anxiety. And the brain is very good at trying to avoid situations that's going to make you feel uncomfortable or that creates stress. And then that is what leads to often psychogenic erectile dysfunction.
Okay.
I'm not thinking about it. Why? Because I'm scared of it. I don't want to put myself in a situation where I'm going to be embarrassed. So let's rather avoid it. And that is probably one of the biggest causes of sexual dysfunctions in our partners.
Okay.
So, you know what, there's a lot that plays a role.
So basically you're saying that it doesn't, there may be absolutely no physiological issue at all.
Yeah.
But from a psychological point of view, you've basically talked yourself down to not even wanting to engage.
It's very interesting if I look at the different ages of men coming into the practice presenting with sexual dysfunction. If you look at your younger patients, and here I'm talking patients in their 20s and 30s, they have psychogenic erectile dysfunction. If we look at the causes of the plumbing starting to be a problem, here we look at neurological conditions. So either an accident or a neurological disease, motor neuron disease or something like that. Cardiovascular problems. One of the first signs of cardiovascular disease is erectile dysfunction, because it all depends on blood flow.
Yes, yes.
So if you have compromised blood flow or damaged sponge tissue in the penis, you're going to have problems with either getting or maintaining that erection. And this starts happening, I would say, from our 30s and 40s onwards. Now, let's look at some of the other comorbidities that go hand in hand. Patients with elevated cholesterol levels.
Yes.
The artery that supplies the penis is one of the smaller arteries in the body. So it's one of the arteries that's also prone to having cholesterol plaques forming in it, decreasing blood flow.
Yes.
And then diabetes or uncontrolled sugar levels in the blood. Sugar is toxic for us, actually. So when glucose levels start increasing, it creates inflammation. Now, ask anyone that battle with joint pain, etc., etc., they know that if there's inflammation, it flares up, and that's the body's now starting to attack this tissue. So you damage the sponge tissue in the penis, leading to erectile dysfunction.
Okay.
Often some of the medications that we are taking, specifically psychoactive ones, so either for the depression or anxiety, blood pressure medication, medication for diabetes, that can all have a negative impact on blood flow, besides the impact that they have on the psychological system.
Okay. So Mark, I mean, there are a lot of influencing factors here, and a lot of them are based on other systems in the body, which then sort of filter down to the erectile and then sexual dysfunction. So in terms of managing the broader system, in order to bring things back in line, I mean, we've spoken about hormone replacement therapy on numerous occasions, and the benefits to mental, to sexual, to physical, physiological.
Yeah.
What would be a sort of an indicator that you might want to consider something like hormone replacement therapy for sexual dysfunction specifically?
Michael, I think if you start having a change in libido and sex drive and erectile functioning in a good relationship, you should start thinking, what else is underlying that I'm not aware of? And let's, again, if you're in a happy, healthy relationship, there shouldn't be changes to your sexual desire and functioning. But if that now starts changing, what else is there? Am I starting to show signs of an underlying condition that hasn't been diagnosed? So hormones, very big role, because hormones, whether it's testosterone, whether it's insulin, whether it's thyroid hormone, they all have an impact on functioning of systems to keep them optimal.
Okay.
So erectile dysfunction, usually a sign of underlying conditions, and therefore you have to go and look for them.
Right. So what would the process be of looking? I mean, how do you start to assess, okay, this is an indication now that this is potentially a hormonal issue, or just to do the general check across all aspects to kind of start to identify and narrow down the potential issues that we're looking at?
I think the biggest thing that you can do as a patient is find the practitioner that you are comfortable with in discussing this problem. We need to understand your medical history. Those are things that have happened from the day that you were born to where you are now. Then your GP or your healthcare provider needs to have a very good understanding of your current medical condition. Do we have other comorbidities? Do we have hypertension? Do we have insulin resistance or diabetes? What is happening with your cholesterol levels? Is there medication that you are taking that can negatively affect all the above? So that good understanding. And then other symptomology. So do we have fatigue? What is happening with your sleep? It's probably the most important thing that you need to look at is, do you wake up refreshed in the morning? If you're not refreshed in the morning, what is the problem? Is it quantity of sleep or is it the quality of your sleep? And usually it's quality. Do you snore? Do you sweat at nighttime? Diet plays an incredibly important role here, because if you're going to take things high in fats and sugars and nitrates, you know what, that has a negative impact on blood pressure and blood flow. Physical activity plays a role. So all of these things need to be discussed with your patient to come up with a treatment protocol that includes lifestyle changes. I think so often we think of, I'm not getting the erections that I want, so you know what, in passing, when I see my GP, I'm going to say to, you know what, I have a little bit of problem. Can I have a prescription for one of the erectile functioning medications? And most probably your GP will oblige. Yeah, you know what, without going into the detail.
Yes.
There's different treatment modalities. And hormone replacement is number one on my list in my practice.
Right.
Once you have identified other comorbidities, now we can start thinking of other treatment modalities, regenerative therapies. We can think of peptide therapies. We can take a look at neuromodulators that improve blood flow. We can look at prescription medication. So there's different treatment modalities for different causes and degrees of erectile dysfunction. And I think you have to be part of this conversation.
Yes, yes.
As a patient, know there's different options available.
Okay. Mark, if somebody feels they'd like to get in touch to discuss this further, how can they get hold of you?
Easiest is to follow us on social media. We are available in Johannesburg on 010-824-1393. So for Umhlanga and the rest of South Africa. And our website is www.thetclinic.com.
Great. Mark, I think just from this discussion, probably some guys out there thinking there is hope and there's solutions out there. So I hope that they find you. Thank you so much for sharing your insights.